Okay, let's do a quick testing before we begin here. Can you guys hear me through the webinar? Testing, testing, 1, 2, 3. Testing, testing, 1, 2, 3. We all good? We're all set? Perfect. Good morning, everyone. Welcome to our eLotus webinar today. My name is Donna, and I will be your host and your moderator for today's class. Here at Lotus Institute of Integrative Medicine, we have been holding educational seminars and webinars for over a decade now. And it's been such a great journey, filled with many experiences and lessons taught by speakers who are not only experts in their respective fields, but more importantly, they're willing to share their wealth of knowledge with all of us. We believe that the future of TCM and the advancement of Chinese medicine can only be obtained through continued growth, learning, and progress. And that's our goal here at eLotus, and we're so glad to have you join us today. One of the ways that we are able to help you here is with our live CEU webinars. As acupuncturists, we do need to complete CEU courses, so why not choose courses that you can use in your clinic and it'll be useful for you. And if for any reason you're not able to make it to our live webinars, we do record them, and you can also purchase the courses as distant learning courses and receive CEU credit. Today's class is Bloodletting Safety Concerns and Review with Dr. Henry McCann. Dr. McCann is the author and co-author of Dong books, Pricking the Vessels, Bloodletting Therapy, and Practical Atlas of Dong's Acupuncture, respectively. He earned his diploma from the New England School of Acupuncture and his doctoral degree from the Oregon College of Oriental Medicine. As part of his doctoral studies, he interned at the Chengdu University of Chinese Medicine in Sichuan, China. Currently, he is pursuing a PhD through the Nanjing University of Chinese Medicine. Dr. McCann is also faculty at PCOM New York and teaches for the doctoral degree programs at Oregon College of Oriental Medicine and American College of Traditional Chinese Medicine. So, without further ado, this class is going to be a 2-hour class. We'll do a short break after an hour. So let's go ahead and hand the mic to Dr. McCann.
Okay. Okay, we're good? Okay. Thank you everyone today for coming. We're going to spend some time today looking at some safety concerns. We'll review some safety concerns, including things like safe handling of blood and other potentially infectious material, how to handle needles, dealing with clean needle technique. After having written a book on bloodletting therapy, it's been in print for a number of years now, I'd say the one thing that I had, in retrospect, wish I included more of was a discussion of the best information we have, at least to date, on the safe application of bloodletting or bleeding as a therapy. And I will most likely, just to say this out loud, I will go back and forth between using the term bloodletting and bleeding interchangeably for the purposes of today's lecture. So this was a segment of a lecture that's been changed a little since then, a segment of a lecture that I did for the first time about a year and a couple months ago out in Denver for the first time. And I think it was a really great addition to the class we were doing on bleeding in general. And so at first, I remember putting this together and thinking, and most everyone knows this kind of information already, but it turns out that a lot of us, especially those of us who've been out of school for quite some time, maybe start forgetting a little bit about sort of the safe handling and the clean handling of needles. And it's really an essential aspect of practice. Not only how we treat patients, but also how we maintain the best practices in terms of cleanliness of the techniques we're doing. All this is really very essential to the practice of acupuncture today. And so that was the idea behind coming up with this short introduction or short review of material that I think most of us have learned already, but never hurts to hear it again. I will also say, and the reason in the slide here that I have the safe practice of bloodletting therapy and handling of sharps blood and OPIM as other potentially infectious material. And then I put the date December 2018 because over time this information will change, and maybe in a couple years we'll have to do this again at some point based on the best information that's available at that time. So I've tried to do the best I could at getting the best information that's current and up to date. I've tried to identify the sources for each of the information. I think that one of the challenges we have in Chinese medicine that I think over time we need to really overcome is really properly sourcing our information. As a teacher of Chinese medicine, and I've been a teacher of Chinese medicine at the master's degree for quite some time at this point, one of the things that makes me gnash my teeth and creates rage in my heart is that so much of the textbooks we have are presented with very little citation. Where do we get this information? Even when they say, oh, the Neijing says blah, blah, blah. Where in the Neijing? What chapter of the Neijing? Are we looking at classical material? Are we looking at modern references? But I think citing material is a challenge in our field that over time we need to really start working on. And so most everything here in this lecture we can cite back to some sort of published and some of it peer-reviewed literature. So that's the brief introduction. Let's look at some of the material. Okay. So first, just defining what bloodletting therapy in Chinese medicine is. So here we're talking specifically about the purposeful elicitation of bleeding from the surface of the body for therapeutic purposes. So this will be different, for example, than regular filiform needle acupuncture, where when we take the needle out, sometimes bleeding happens accidentally, right? When we are doing regular acupuncture, we know that bleeding from the point is something that can happen, but it's not something we're anticipating happens every time we take a needle out, right? And the amount of blood oftentimes is very different. When we're doing fine needle regular acupuncture, and I'll just call it acupuncture for the sake of brevity, if a point bleeds, it tends not to bleed more than a drop or two of blood. So handling that kind of bleeding is very different from handling a therapy where we know we're going to elicit most likely more than a couple of drops of blood. If you've practiced doing any sort of bleeding or bloodletting therapy, you certainly know that once in a while we prick a point and very little blood does come out. But sometimes we can elicit half a teaspoon, even up to a tablespoon or more of blood from a point after it's been pricked. So there's definitely different. When we're talking about bloodletting therapy today, we're going to be talking about the purposeful elicitation of bleeding, what we're going to do when we're doing a technique that we anticipate will draw out more blood than an accidental drop or two of blood after regular acupuncture. Okay? And as we have questions, please pop them up on the board, and Donna, you can interrupt me if there's some good questions that come up. We have plenty of time to go for the material, so if there's some questions you think, then please. Just a little bit of background on bloodletting therapy. Bloodletting therapy, to put it bluntly, is very old. Bloodletting therapy has been around in Chinese medicine significantly before even regular fine needle acupuncture. When we look at the historical references, we can see references to bloodletting potentially as far back as the Shang Dynasty. And the Shang Dynasty you'll see on this slide is roughly 1600 to 1027 BCE. That's BCE is the same. This is before the turn of the Common Era. Now, the references to bloodletting this far back are debatable historically. Some historians think, yes, they were doing bloodletting then based on the record we have. Some historians maybe don't necessarily agree with that. That said, we do know that bloodletting goes back quite a long time. In the archaeological record, we have references to bloodletting easily to the early part of the Han Dynasty, and the Han Dynasty is roughly 200 years before the turn of the Common Era to 200 years after the turn of the Common Era, and even most likely several hundred years before that. So, based on the current available archaeological evidence, it is safe to say that bloodletting therapy, along with techniques such as moxibustion and manual therapies, today we would call something like Tuina or Anmo, different terms were used in the past, these therapies all significantly predate fine needle acupuncture by a long shot. Fine needle acupuncture is a very technologically advanced therapy in that to be able to make a fine filiform needle that's sharp, that can be used more than once, because in those days they were using them more than once, certainly, the metallurgical technology design that you'd have to design that kind of needle is much more advanced than using some sort of tool that can cut the surface of the body for bleeding. So bloodletting therapy has been part of Chinese medicine from its very inception, and it's part of acupuncture practice even before acupuncture was a practice, in other words. So in the Neijing, which is sort of the foundational text of Chinese medicine, the way we think of Chinese medicine today, bloodletting therapy is amply represented. So we have at least 20 chapters of the Su Wen and 26 chapters of the Ling Shu. Remember, there are 81 chapters total in the Su Wen and 81 chapters total in the Ling Shu. So 20 and 26, those are the number of chapters that have explicit references to bloodletting. And explicit references mean when we read them, they are without a doubt a reference to the purposeful elicitation of bleeding from the surface of the body. There are many, many, many other references throughout the text that could very well be bloodletting in nature, although scholars might disagree in terms of the language they use to actually describe the procedure. So my guess is that there are more chapters in this that really were talking about bloodletting, although from a more historically rigorous standpoint, these are the number of chapters that have explicit references. The most common area for bloodletting in the Neijing is the popliteal fossa, and we may see some popliteal fossa bleeding later on today's class, or a point close to the popliteal fossa. This is the area of bladder 40 of Weizhong, the back of the knee. In terms of Dong's acupuncture, for those of you who are familiar with Dong's acupuncture, since a lot of what I've written about, including in the bloodletting book and our book on the Practical Atlas of Dong's Acupuncture, is on this specific lineage of acupuncture, bleeding plays a very, very important role. I would hazard to say that it's almost impossible to really practice Dong's acupuncture unless you're also using bloodletting in your clinic. And later this weekend, for those of you who will be joining us on Sunday, we'll be talking about bloodletting for a wide variety of conditions. So in Dong's acupuncture, the back of the knee was also a frequently bled area, especially for things like back pain and hemorrhoids. So these were specific indications, among others, that Master Dong would have bled the back of the knee for. Now, this is a great quote. This is from Xu Dachun, who is a Qing dynasty physician. This text has actually been translated into English. It's a series of essays written by Dr. Xu. He says, one of the pricking methods in ancient times was to take blood in large amounts. This is outlined in great detail by the Ling Shu in its discussion of the blood-luo network vessels. In particular, in cases of headache and pain in the waist, one must drain the blood in large quantities. Whenever some evil is located in the luo vessels, they must be eliminated completely. Now, the best part of this quote is what comes next. Today, if people happen to see some blood, both patients and physicians are frightened and lose all direction. And then he laments, how can an illness be removed? And so what Xu is saying is that bloodletting is essential, but somewhere along the way, and what's interesting to me is that Xu wrote this over 200 years ago, and it could easily be said today in the modern clinic. Somehow, we as acupuncturists, practitioners of Chinese medicine, have, for some reason willingly given up this essential part of our therapeutic repertoire. And part of it is out of fear. And in my experience, having taught this for a long time, a lot of the fear comes from, how do I explain this to patients? How do I handle the therapy correctly? So today, the safety review will hopefully go a long way in making this therapy a lot less frightening for people, right? It's actually, in my opinion, in many ways, safer than fine needle acupuncture. The bleeding needle is never inserted more than a few millimeters into the skin. So there's no way, if you're doing the therapy correctly, there's no way you're going to create a pneumothorax. You're not going to puncture an internal organ. The wound is self-cleaning because as the wound bleeds, it pushes whatever bacteria might be present out. So it's cleaner for the patient than fine needle acupuncture. So there really is nothing to be afraid of. The thing that scares people most is simply the handling of the blood. And so that's why we're going to go over this today, ease people's fears a little bit, make it a little bit more user-friendly, and then hopefully encourage people to use it more in their clinics. So first, and I've said this a number of times already, in my opinion, bloodletting is an essential part of acupuncture therapy, and it has been since its inception. If you are using Chinese herbal medicine in your practice, which many people do, if you're using Chinese herbal medicine in your practice, I think you can get away with doing a lot less with acupuncture. If you are not using Chinese medicine in your practice, in my opinion, you must, if you really want to treat the largest variety of patients you can, you must be employing moxibustion, fine needle acupuncture, and bloodletting as the big trio. And we'll talk more about this trio of therapies and compare that with some of the other ways that famous doctors in contemporary China have described acupuncture practice on Sunday's lecture, when we look at the collection formulas and basically master dong treatments and bloodletting therapy for that series of formulas. Now, knowing that bloodletting is an essential part of practice, based on the best evidence and practices that we have today, and I guess, and as I said before, that means that this best evidence may change over time, but based on the best evidence we have today, how can we safely perform the therapy in our clinics? And that's the question we have in front of us now. So just a basic safety overview. A lot of the material from today's lecture comes from the Clean Needle Technique Manual. We're currently on the 7th edition. This revision, the latest revision, happened in 2016. The Clean Needle Technique Manual is available free online as a PDF. If you search for it, it should be fairly easy to find. I would encourage all acupuncturists to download this and actually read it. Most of us had to read it when we were in school. This year I've been in practice for 20 years, which means I've read a number of editions, but in my own practice, I make a point of trying to figure out when a new edition comes out and actually reading it. I think it's important for us to stay up on this information. So let's look at some of the safety specifically to bloodletting therapy. The truth is that there are currently no studies of safety or adverse events in the English language that relate specifically to bloodletting. We have quite a bit of safety literature on acupuncture. Some of the safety literature you'll see cited later in today's talk. But currently, we're basically taking information from other acupuncture studies, from studies on regular hypodermic needle use, and basically extrapolating that for bloodletting therapy. Someday there may be people who are funding studies on bloodletting safety, but right now there are no specific studies in the English language. There are some documented but very, very rare risk of infection associated with using lancets when they're withdrawing blood from the heels of infants. This happens in neonates for lab analysis. Although, again, this is very rare. There was a systematic review of wet cupping, and wet cupping is bloodletting with cupping done to help draw more blood out. So when they say they're talking about dry cupping versus wet cupping, dry cupping would be the normal use of cups on the body without bleeding, and wet cupping, this refers to using cups to draw more blood out. There was a systematic review of wet cupping for the treatment of herpes zoster. Herpes zoster, this is shingles. There were no adverse events reported in this clinical trial. There are, however, a small handful of case reports of infection that were related to wet cupping. The best way, and we'll mention this again, the best way to make sure that you don't have infection from wet cupping if you're doing it in your clinic, which I do in my clinic, is one, you must either autoclave reusable cups, and in my clinic we don't have an autoclave, so what do? The strong recommendation is that you use disposable cups in the practice of wet cupping. And disposable cups are readily available on the market. You can get disposable inserts for regular cups, or you can get entire disposable cups. I think I pay no more than between 25 and 50 cents a piece for disposable cups. So it's easy to deal with, but there is some literature that suggests that wet cupping, if the materials aren't kept sterile afterwards, can create infection. There is one documented case of transmission of hepatitis from a lancet where the lancing device was used on more than one patient. This is a really, really important thing and something that I've seen acupuncturists do, and I've had acupuncturists tell me about, that also makes my head explode, to put it lightly. And we'll talk about this idea of lancing devices shortly as well. So let's look at some of the possible adverse events that can happen from bloodletting therapy. So the first possible adverse event, or side effect, in other words, is infection. And we'll talk about infection to the patient and infection to the practitioner who's employing the therapy, because both are possibilities. So first, infection to the patient. The first thing to know is that this is extremely rare. The way we avoid infection to the patient, the most important thing, which should be a no-brainer, but I'll make sure I say it out loud so we all hear it, we don't reuse needles between patients. If you are using a traditional bloodletting needle that you purchased in China and you're using it on more than one patient, it must be autoclaved in between patients. Keep in mind that some state laws in the United States do not allow for reusable needles anymore. Some state laws specify you must use single-use needles. Some state laws still allow people to autoclave. I think autoclaving is a big hassle, so the best recommendation is use disposable needles. I will also say, because I forgot to say it right off the bat, that this information that we're talking about today is based on best practices as defined in the United States. Do you know if we have any international viewers today, Donna? So so UK. So I have to admit I do not know what all the best practice standards are for countries outside of the United States. I will say that the standards we're talking about today, I think, are fairly universal. When I've taught in Europe, I think, in my experience, when I've taught in Europe, which I've taught quite a bit in Europe, I haven't taught in the UK, but I've taught in numerous places on the continent, I've taught in Ireland, the standards tend not to be as strict that I've seen as the United States. We tend to be a little bit more, I think we're just a little bit more, I don't want to say phobic of making sure we're using everything as clean as possible, because I think it's a good idea. But my impression is that the standards we're talking about today will probably be at the same level, if not higher, than most jurisdictions. If you are living in a country outside of the United States, by all means check with your local either acupuncture regulatory board, professional associations, whatever there are for the best, safest practices. What I'm going to recommend is that we always default to the strictest standard. So for example, if you live in a state that allows for autoclaving of needles, I would still recommend, just as a matter of being absolutely safe, that if at all possible, use disposable needles. I never use reusable needles in my clinic. Everything is disposable. So the infection to the patient, the first way we avoid it is by not reusing needles. The second way we use it is by not using even the same needle on the same patient in different parts of the body. If, for example, you are pricking a vessel on the back of someone's knee in the area of bladder 40, and there are 2 or 3 places right in that same vicinity you're pricking, you can use the same needle for 2 or 3 pricks in that same area. But you may not use the same needle, for example, for pricking someone's bladder 40, and then later going back and using it on their Jingwell points. Right? There is a possibility, because different kinds of bacteria exist on different surfaces of the body, that you can have a cross-infection on the same patient using the same needle. So my recommendation is, if you are bleeding more than one area of the body, even if you're needling one bladder 40 and then the other bladder 40 on the same patient, use separate needles. Right? Needles are not that expensive. It's not worth risking infection to the patient. Okay? After that, as I mentioned before, if you are doing wet cupping, if you're doing wet cupping with reusable cups, those cups must be properly sterilized. And sterilization, remember, sterilization is a specific definition. You cannot sterilize by boiling in water. You cannot sterilize by simply washing with soap and water. Sterilization means the absence of all microbial life. And you can do that with cups by using either very, very toxic chemical baths or autoclaving. It's such a pain in the neck. My strong suggestion is use disposable cups. In my clinic, we use disposable cups. And likewise, if you're using disposable cups, you may not use that same cup on different areas of the patient's body. So let's say we're going to cup someone's low back to take some blood out, and then maybe cup someone's upper back to take some blood out. You cannot take that same cup cup and take blood out of the low back and then wipe it out and then use it again on some other part of the body. Each part of the body uses a separate disposable cup, right? So this is the best way to avoid infection of the patient. The other best ways to avoid infection is practice CNT. CNT, for those of you who have forgotten or not familiar, is clean needle technique. Practice CNT guidelines for hand sanitation and skin preparation. And we also want to inspect the patient for areas where there are signs of significant infection, lesions, inflammation. My recommendation is do not bleed these areas, bleed other areas. Those of you who are familiar with Dong's acupuncture will remember that in my opinion, one of the strengths of Dong's system is that we don't have to needle directly into the area where the disease is located. Likewise, we don't have to bleed into the area where the disease is located. Just because you have inflammation and swelling or an injury in one part of the body does not mean that that is the best place or even a desirable place to bleed. Right? For more information on Dong's acupuncture or bleeding other areas of the body, we have a lot of other classes here on eLotus. I've done one myself on bloodletting therapy that I'd encourage you to go take a look at. Now, this is a very, very important point, and as I mentioned very briefly before, this makes my head explode. So, you ready? Here we go. This is a quote specifically from the Centers for Disease Control, and I gave you the URL where you can read more about this. The emphasis added is my own addition. Fingerstick devices, also called lancing devices, should never be shared even with close family and friends. This guidance includes both the lancet, in other words, that thing we use to puncture the skin, and we'll show you what a lancet looks like, and the pen-like device that houses the lancet. Neither should be used for more than one person. So this item here is what I'm talking about. So the lancet are the small blue things there that are the actual needles. Right above that, do you have a pointer you can use, Donna? Oh, I can point it up here. Can you see this? Right. These are the lancets. These are the actual needles. Okay? This is the lancing device. This is commonly used, for example, by diabetics in checking their blood sugar levels. And what happens is this lancing device, this end portion here screws off, and this small needle is loaded in, and there's a spring inside. So that when you load it in properly and close it up again, you hit the trigger on the end, and the spring makes the little lancing device, the needle pop out of the end for just a split second, boom, and it punctures the skin. So diabetics will do this by squeezing their thumb, or their finger, or now they do it in other parts of the body as well. They activate the trigger. They're supposed to throw the lancet out. Many of them will reuse them because they want to save money. But this device here, this plastic device, is never to be used in acupuncture practice. This is an absolute. The reason being is because some blood can actually get inside of the housing, the plastic housing. Because it's plastic, it cannot be sterilized. You cannot autoclave plastic. If you'd like to try, go ahead, and you'll see you have a puddle of melted plastic on the inside of the autoclave when you're done. There have been cases in the medical literature of people getting infections, even when they're changing the needle, when they're sharing the lancing device between people. For diabetic home use, people can use this on themselves more than once. But even at home, the recommendation from the CDC is never to use these, even on other family members, close friends, relatives, whatever. So there is no place in acupuncture practice for this device. I'll say it again. There's no place in acupuncture practice for this device. There are some modern spring-loaded lancet devices that are disposable, where the entire mechanism is disposable. If you want to use this, as long as the entire thing is disposed of, then that's permissible. But you may never use a lancing device in acupuncture practice. So don't do it. You've been warned. Okay. I know people do it. Don't do it. Okay. Now let's talk about infection to the practitioner. Infection to the practitioner comes from contact with blood or other fluids. So the the best way to deal with contact with blood or other fluids is use personal protective equipment. Personal protective equipment includes gloves, and we'll see glove use later today. In other cases, face masks. If you are expecting that there's going to be a blood splatter, then you can use a plastic face mask with a gauze covering for the mouth. In my experience, this is very rarely necessary. Other protective equipment includes things like lab coats if you're doing a lot of bloodletting, or if you're expecting to have blood potentially on clothing. So the best way to protect against contact with blood or body fluids is personal protective equipment. The one essential piece of this for acupuncturists, in my opinion, and based on the literature we have today, is gloves, the disposable gloves. The other type of infection that's potential to practitioner is needle stick injury with a used bloodletting needle. Needle stick injuries are quite possible, and which is really probably the biggest risk of infection to practitioners. We'll talk a little bit more about needle stick injuries a little later. Other possible adverse events: localized pain. This is to the patient. Localized pain happens, in my opinion, when the bleeding needles are used inappropriately. So oftentimes it comes from when the bleeding needle is we use a bleeding needle and puncture too deeply by accident. We'll talk very briefly today about how to hold the bleeding needle and how to control depth. But then there are other courses on this topic in terms of how to actually hold the needle that we've gone over in the past. And so I'd encourage you to take a look at those. The best thing to do is actively encourage patient communication. So tell the patient, I know we all have to hear this out loud again. Make sure you tell the patient to let you know if something is uncomfortable. A lot of times we simply forget. My own first acupuncture experience when I was in college, I went to see an acupuncturist, and the acupuncturist was doing moxa on my wrist, on my pericardium 6, my niguan, and he didn't tell me I should say, "It's too hot." And I had a little burn there. I started seeing the skin peeling. And he said afterwards, "You should tell me if it's hot." And I was like, "I don't know to tell you. I figured you know what you're doing." So if he had told me, tell me if it's too hot, I would have been able to say it's too hot. Likewise with the bleeding needle, if you do one puncture and it hurts the patient, you'll want to know that before you do a second puncture, if you're needing to do a second puncture. So just talk to your patients. It's not a bad thing to do. Bleeding. Now, bleeding, it's obvious that bleeding is the effect of bloodletting therapy. When we say bleeding, we're talking about uncontrolled bleeding as an adverse event, right? So uncontrolled bleeding means once you've done the puncture, the blood simply doesn't stop, or you're having a hard time getting it to stop. The way we deal with this first is to make sure you take a thorough history, including a thorough medical history of your patients, including history that would ask about bleeding disorders, medication or supplement use. It is not a contraindication to use bloodletting on patients who are on blood thinners or other types of anticoagulant therapy. However, you will want to make sure that if a patient, for example, has some sort of problem with controlling bleeding, either because of their medical history or because of medication or supplement use, you apply bloodletting a little more judiciously. Try not to bleed larger veins. Make sure you bleed them at the beginning of the treatment. So one of the ways we avoid this is new patients, especially if you don't know how a patient responds to bloodletting, bleed them before you do the acupuncture. That way they're going to be in your office for the next 30, 45 minutes, an hour, whatever it is, so you can observe their response to the bleeding therapy, right? If you bleed them at the end of the treatment, my suggestion, especially if you don't know how they respond to bleeding for new patients, have them stay in your office for at least another 30 minutes so you can observe their response. You can also use a small pressure dressing as necessary at the location of the bleeding. This is especially if you have a hard time getting the bleeding to stop. So a small pressure dressing is you can tape down a cotton ball, you can use a Band-Aid, something that actually keeps a small dressing pressed against that wound so as to be sure that it stops bleeding, right? And we'll demonstrate a small pressure dressing later today when we do the bloodletting. Whether we need to or not, we'll demonstrate the pressure dressing just so we can see what it looks like. This is just a brief literature review, which I think is important for us to know, and here's the citations. Regular acupuncture based on the current literature, is safe with patients on warfarin or antiplatelet medications. Newer research also shows that acupuncture is safe with newer anticoagulants, such as Pradaxa, Xarelto. These are the sort of next generation after warfarin is Coumadin, by the way. These are the next generation of anticoagulants after Coumadin. So the literature out there suggests that regular acupuncture is safe with these patients. So their doctors don't have to worry if they're on some sort of heart medication. They can't get acupuncture at all. We don't have specific studies related to bloodletting needles, but I think we can easily extrapolate that a small puncture is relatively safe as long as we're using proper wound care afterwards, making sure the patient response is okay in the office. But again, I would use more caution with bloodletting needles. Try not to bleed larger vessels. It's always safer to bleed patients on the upper part of the body if they're on anticoagulants. There's simply less gravity that will create longer bleeding. So it's safer to bleed Jingwell points in the hands, bleed the upper back, bleed the trunk. Those are areas that bleeding is safer. For those of you who practice Dong's acupuncture, you remember that bleeding the trunk is a big deal for us. We do a lot of it. And so I would, again, refer you to either my book on bloodletting therapy or other courses on Dong's bloodletting that really discuss more about bleeding the trunk. Okay, bruising is the next possible adverse event. Bruising is a common side effect of even regular acupuncture. It is more common with bloodletting therapy than regular acupuncture, in my experience. And again, I don't have literature to back this statement up, but through my clinical experience, I've definitely seen this to be the case. We're using a larger bore needle most of the time when we're doing bloodletting therapy. Most of the time, the way we get around this is take a thorough medical history, including, again, bleeding disorders, medication, supplement use. Those patients, we try not to bleed on larger vessels. And then the most important thing is simply tell your patients that there will be an increased risk and a likelihood of bruising. So this is the same thing, for example, if you're doing cupping. In the summer, when I'm doing cupping on patients, I want to ask them first, are you going to the beach this weekend? Do you care if you have cupping marks on your back if you're going to be in a bathing suit? Or if you're going to a wedding with a backless dress, do you care if you have cupping marks on you? If they say, yes, I care, then you skip it. You go to next time they come in, you can do cupping. Same thing with bleeding. If you're doing bleeding on an area of the body that may be exposed, let the patient know that there is a risk of bruising. The risk of bruising is always greater on the lower extremities, on the legs, again, because of simply more gravity, bringing more blood down to those vessels. You're not going to get as much bruising, for example, on the Jingwell points of the fingers, on the upper back, on the apex of the ear. But if a patient is going to be self-conscious about a bruised bladder 40 area, then you want to simply give them the option of whether they want that therapy done at that time or not. If they do have bruising afterwards, then the best recommendation is the topical application of warm compresses at home after treatment to get that bruising to clear up more quickly. Okay. Fainting and dizziness. This is similar to risk with conventional acupuncture therapy. It is always a possibility. The best way to get around this is to make sure that we treat patients while supine or prone. I know some people bleed with patients standing up. I've done this in the past, and I will not do it again. This is a much greater likelihood of patients feeling faint and falling right over. I've had patients feel faint, but I've never had them fall over, but I've had lots of students of mine tell them that the patient almost fell completely right over because they felt faint after being treated while standing up. Always treat patients while lying down. That's the ideal situation. If you can't treat them lying down, then they should be sitting down. So the first way we get around fainting or dizziness is never bleed with a patient standing. I recommend you don't needle with the patient standing either. In my clinic, some of you who've taken classes with me know before, it's not uncommon in Dong's acupuncture to needle parts of the body and then have the patient stand up and walk or move. But when we needle them, they're always sitting down first. We never have them stand up and then put the needle in. They're always sitting down first, then you put the needle in. As long as they feel okay, then they can stand up with the needle in. The other thing that's important with fainting or dizziness is to practice appropriate patient positioning, right? So you want to make sure that if the person is sitting up and they feel dizzy, they're not going to slump forward and fall onto you as the therapist, right? So it's really sort of basic common sense thing. The other way to avoid fainting or dizziness is avoid treatment if the patient is very tired, they're scared, or if they would otherwise not be a candidate for conventional acupuncture therapy. If they feel dizzy afterwards, the treatment is done. Do not do any more bleeding. Do not do any more acupuncture. Give them something warm to drink. You can do acupressure on heart 8. This is Dong's point Jie, J-I-E, which means release, which we talk about quite extensively in our Dong acupuncture classes. But this is the main point for relieving dizziness after acupuncture in Dong's system. Other things to keep in mind, my suggestion, strong suggestion, is to avoid bloodletting in pregnancy. I have bloodlet in pregnancy before, but it's only in very limited cases, and I've had extensive experience in bloodletting patients. So if you're new to the therapy, I would say avoid entirely bloodletting in pregnancy, and if it needs to be done, it's only done in very, very rare cases. My suggestion also is, even if you're bleeding in pregnancy, do not bleed the lower extremities in pregnancy. Do not bleed the distal extremities of patients with poor perfusion due to diabetes or cardiovascular disease. This is also another very important potential side effect. If a patient has diabetes with peripheral neuralgia, so they have poor circulation and poor nerve sensation in the lower extremities, do not bleed these patients from the knees down. Right? I've had many cases of students telling me that they wanted to treat, for example, neuropathy, and they were bleeding the patient's legs. This runs the risk of creating a non-healing wound that is a nightmare for the patient, and as a therapist, it will be a nightmare for you as well. This is another example where bleeding distally, or I would say distantly, because we're now proximal to the site of disease. Needling distantly and bleeding distantly has its advantages, and in many ways is superior to conventional local needling. If the patient has very, very poor circulation in an area of the body, don't bleed that area, bleed somewhere else. This is much safer and, in my opinion, actually more effective therapeutically. Okay. I'll give you a little example, a very quick clinical example. I had a student of mine who had a patient with diabetes and neuropathy, and she was bleeding an area of the leg. And after maybe the second application of bleeding, when the patient came back for the third visit, one of the wounds from the bloodletting didn't completely heal up, right? And so it didn't create a non-healing wound, but it looked like it might have had it. She kept on doing it in the same location. So she called me and said, what do I do? And I said, well, first of all, if you're practicing Dong's acupuncture, you're not doing that kind of local bleeding anyway. Bleed the upper back. And there are points on the upper back that we can use to treat problems of the distal extremities. And those are in the bloodletting book and in the classes that we talk about. So we won't go into specifically where. But what happened is she reported back to me. She had the patient sitting up so she could bleed the patient's upper back. She did the bleeding on the patient's upper back and had the patient wiggling their toes. And the patient said, I don't know what you're doing, but all of a sudden I have more sensation in my feet. I can feel things differently right after the bleeding of the upper back. So bleeding distantly will also have an effect, just like needling distantly as well. So that's a big, big no-no, is not bleeding distal extremities of patients with poor perfusion. The other thing we want to be careful of is bleeding patients who are very elderly with thin or fragile skin, because again, this may create a non-healing wound. I certainly believe that bloodletting is important even in patients with vacuity or deficiency patterns. Bloodletting can be done on elderly patients, and one of my clinical specialties in my doctoral degree was in geriatric medicine, so I see quite a lot of elderly patients. We bleed them frequently. But you do need to be more careful when we're bleeding patients with very, very thin or fragile skin. Okay, any questions, really important questions so far for possible adverse events? Otherwise, we'll go on to hand sanitation review. Anything come up, Donna? Okay. Let's go on to hand sanitation review then. So the hand sanitation review, this is basically along the lines of clean needle technique guidelines, is a review for all of us. Hands should be washed with soap and water or with alcohol or an alcohol-based hand sanitizer. So if you don't have access to a sink, right where you are for whatever reason, you can use alcohol or alcohol-based hand sanitizers, something like Purell type of sanitizers. If we're using alcohol, then the alcohol needs to be between 60 and 70% isopropyl. Higher, and the same thing when we're doing skin preparation on the patient. So if you go to the grocery store or the pharmacy, you'll see you can get up to like 85 or 90 or even 95% isopropyl alcohol. This is ineffective for proper sanitation, for proper cleaning. One of the ways that alcohol works is by contact time on the skin. 90%, 80%, anything above 70% isopropyl evaporates too quickly to be useful as a real sanitizer. I'm not sure why they still sell it, but they do. Don't use it in your clinic. So we wash our hands either with soap and water or an alcohol-based sanitizer prior to a clinical procedure, before going in to see the patient or before touching the patient. After contact with a contaminated or unclean surface. For example, if you clean your hands and you're starting to swab patients, but for some reason need to pick up your pen and take more notes in their chart, the pen and the chart are not clean surfaces. So once you put them down, you have to sanitize your hands again. There is a difference between a clean field and a sterile field. Remember that acupuncture is not a sterile procedure. We use sterile medical implements. The needles are sterile. The bloodletting needles are sterile. Plum blossom, whatever you have is sterile. But acupuncture is not a sterile. You don't have to have everything in the... It's not like a sterile operatory where someone is doing surgery. So a clean field is something that is... A clean field, for example, is where we have needles, we can put needles down as a working surface. So if you have a rolling cart, for example, that's metal, and you wipe down the top of that metal cart with some sort of cleaning agent, then that would be called a clean field. But anytime you touch a contaminated or unclean surface, then you must wash hands again. Before and after eating, wash your hands in the clinic. Before and after using the restroom, you don't have to wash your hands before using the restroom, I'm sorry. After using the restroom, you must wash your hands. After sneezing or coughing, wash your hands. When we're using gloves, a lot of people forget this. When you're using gloves, we do the bleeding procedure, which we'll demonstrate. Once you take those gloves off, you should wash your hands as soon as possible. There is a possibility there could be rips in the gloves. You can have contamination with blood or other kind of material. That you don't even notice. There have been many times in my clinical practice where when I'm taking a needle out and I hold a cotton ball down on the patient's skin, maybe I was not paying attention, I was talking to the patient, maybe my cotton ball was just a little bit off the point and I had blood on my finger and I didn't notice until shortly thereafter. So it is possible to have blood contamination on your body without you realizing it, even if you're wearing gloves. So when you take gloves off after the procedure, you wash your hands again. This is when we're washing hands. You also wash hands anytime they're contaminated with blood, other body fluids, or dirt. Anytime you notice that there's blood on your hands, dirt on your hands, or you've had contact with any other body fluid, then you immediately wash with soap and water. Right? If you have contamination with something visible like blood or other fluids or dirt, then the strong recommendation is with soap and water. This is not when Purell is enough. Okay. Skin preparation for the patient is one way of preventing infection in patients undergoing acupuncture. Now, this is a relatively new change to clean needle technique guidelines. Alcohol swabbing is recommended but not essential before acupuncture needle insertion as long as an area is clean. Right? This is a change from 20 years ago when I was first in school, where alcohol was mandatory swabbing for all points. Alcohol swabbing is no longer absolutely mandatory on all patients, providing the skin area is clean. Research specifically on the benefits of swabbing acupuncture is yet to be done, but we know from the published medical literature, going as far back as the 1960s, research on giving patients injections shows that skin preparation was not needed to prevent infection at needle sites. So in my clinic, I still swab points with alcohol most of the time because it's part of the ritual that my patients have gotten used to over the last 20 years of my practice, right? People know that it's something we do. It's part of getting the patient ready. But it is not actually absolutely necessary. I see this a lot of times where acupuncturists will swab like someone's, like say they're doing do 20, and they swab their scalp. Most of the time, if a person has a lot of hair, like on me, maybe you can get to the skin. They're not even getting to the skin with the swab. You're just basically swabbing the hair, right? So for most acupuncture, it's not necessary, although still potentially a recommendation, as long as the area is clean. When I say as long as the area is clean, it means as long as there's no visible dirt. I had a patient a number of years ago, for example, who was a professional welder. And even after he had gone home and showered quickly before treatment, the dust, the weld dust on his hands and on his body, it was crazy how much stuff there was. Yeah, I can only imagine what was in this guy's lungs, unfortunately. So I used to keep baby wipes in the office just for this kind of purpose. I would take the baby wipes, which is an alcohol-based cleaner, scrub and go through 2 or 3 baby wipes before the baby wipe didn't have something on it that you could see, right? So if the patient is visibly dirty, you should swab them with something. Or wash the area, have the patient go wash their hands and arms or something with soap and water. If it's on the arm, it's kind of hard to wash patients' feet with soap and water in the clinic, but if it's on patients' arms or hands, and have them wash, okay? So in preparation of the skin, either soap and water so the patient can wash their own hands or their arm, 60-70% isopropyl again. Again, nothing higher. Anything higher than that is ineffective. Grossly and visible dirty skin should be washed in soap and water or alcohol-based wipes or an alcohol-soaked swab. Even though acupuncture does not absolutely require swabbing, at least according to the current CNT guidelines, it is still recommended for intramuscular needle insertions. So if you're doing fairly shallow needle insertions, if you do, for example, Japanese acupuncture, it's very shallow needling, it's less crucial to do skin swabbing. If you're doing, like in my clinic, I like to do the 5-inch needle into gallbladder 30 on the hip, that kind of intramuscular insertion still should have still should have swabbing before needling. Because bloodletting is a shallow puncture, as I mentioned before, a bleeding needle only punctures ideally a few millimeters into the skin. It is not crucial because we're not doing intramuscular therapy, intramuscular needling with a bloodletting needle. Is everyone clear on this? We're good? Any questions coming right up? Okay. All of that said, despite what the current CNT guidelines mention, some individual state laws in the United States may require alcohol swabbing of the skin. Right? So nothing we say here in this lecture, and I'll be very clear about this, nothing we say here takes the place of the guiding laws in your local jurisdiction, whether that's in the United States or whether that's overseas, somewhere in Europe or anywhere else we have listeners today. Right? So the recommendation here is to follow all guidelines for professional practice as required by statute or rule and regulation in your practice jurisdiction or in your practice location. For example, if you work in a hospital and the hospital says you must swab skin with alcohol before doing the procedure, then you still must swab skin using alcohol during the procedure. My suggestion is always default to the stricter set of guidelines. Right? So if you live in a jurisdiction, for example, whether it's overseas or whether it's in the United States somewhere, all 50 states laws on acupuncture practice. If the guideline is a lower bar to achieve than what we're talking about today, then the guidelines we're talking about today should take precedence. If in your state they require a higher standard than the guidelines we're saying today, or if in the clinic you work at requires in-house higher standards than the guidelines we're talking about today, then you always default to the higher standards. No state regulatory body will ding you for following stricter standards than the state requires. No hospital will penalize you for following stricter standards. If they do, that's not the hospital you want to work in. If they have lower standards, if they have higher standards though, they will ding you for following even what, as a profession, we say this is our base level standards, right? So we always default to the higher, stricter set of guidelines, right? That's a strong recommendation. For more specific information on hand washing or technique, refer you to the Clean Needle Tech Manual, or the CDC website has a section on hand washing and publications related to hand washing, swabbing, skin preparation, etc. Okay. Let's talk a little bit about standard precautions review. Standard precautions is what is previously known as universal precautions. When I was in school, it was called universal precautions. So these are a set of infection control practices. And this definition comes specifically from the Centers for Disease Control, and you have the URL if you want to read more about it specifically here. The basic idea is that we assume, regardless of the patient, that, and this quote comes from the CDC in blue here, all blood, body fluids, secretions, excretions except for sweat, non-intact skin, and mucous membranes may contain transmissible infectious agents. Just because we think that a patient does not have some transmissible infection does not mean that they do not have some sort of transmissible infection. There are far more people out there with some sort of bloodborne illness, bloodborne infection, that do not know that they have this infection than there are with people who know that they have some sort of infection. They may also not tell you that they have some sort of bloodborne infection. So the basic guideline for safe handling of you as a clinician and of the patient themselves and other patients in your practice is to assume that all blood, all body fluids, etc., as outlined here, are potentially infectious. Right? This will protect you as a clinician and will protect other patients that you come in contact with in the same clinic. Okay? So here's the basic summary. We assume all patients are potential sources of infection. Assuming all patients are potential sources of infection also destigmatizes certain populations and actually patients that you know have some sort of bloodborne disease. Infectious disease, right? If we treat patients all the exact same way, then that is a much fairer and more efficient way of practice. One of the ways we deal with standard precautions is that we utilize correct and frequent hand washing. Hand washing is the greatest deterrent to the spread of disease ever known to mankind, right? So the greatest spread of deterrence to the spread of disease is not vaccination, it's not taking antibiotics, it's the most common thing is the best, hand washing. The other way we deal with standard precautions is we all have to understand appropriate use of protective equipment, personal protective equipment, such as utilizing gloves, disposable gloves, eye protection, and masks as necessary. Our facilities all have to have appropriate engineering controls, for example, hand washing stations. I think it is problematic if you are in a clinic that does not have a sink anywhere. And I know a lot of people, a lot of my students in New York City, for example, office space is hard to find, and office space is often small. So the nearest sink may be in a bathroom outside of an office. This is problematic in my opinion. In my clinic, I do not have sinks in every single practice room, but we have 3 sinks in the office that are all easily available, and 1 sink is always available to everyone. Right? So there's sinks in bathrooms. If someone's in a bathroom, you don't have access to the sink. We have a sink in the office. We actually have 4 sinks in the office now that I think about it. But there's always a sink available all the time in the office for hand washing. So every office should have appropriate hand washing availability. The next important step of standard precautions is isolation of sharps in appropriate sharps containers. Sharps should go in sharps containers that are these red, sometimes orange and yellow containers that are labeled as containing sharps and medical waste. They should be isolated only in that type of container, and they should be isolated in those containers as soon as possible. Right? For example, I don't want to do bloodletting where I'm pricking the patient, putting the needle down next to me on the table next to the patient, dealing with blood, maybe going and getting something else, dealing with more blood, taping things down, all the while that dirty needle is sitting on the table next to the patient. The likelihood that they can stick themselves with it, that you forget it's there, you stick yourself with it, that it falls on the floor, you lose it, it's a nightmare waiting to happen. The ideal situation is as soon as possible after the therapy, the needle, in other words, is isolated in an appropriate sharps container, right? That's one of the ways we deal with standard precautions as well. We isolate contaminated medical waste in a red bag or other appropriate container. We'll talk more about this as well. Correct use of disinfectants is important. So we need to, if, for example, we have a blood spill should be cleaned with a hospital-grade disinfectant. And caution when we're handling sharps, right? So sharps should go, again, directly from my hand into a sharps container. For example, I have interns in my office. I would never take a needle that I had just used, puncture the patient, and then hand it to the person for them to put it in the sharps container. That's also a needle stick waiting to happen, right? So this is some of the basic guidelines and precautions that we deal with under the rubric of standard precautions. So this is a summary of standard precautions from the CDC. We're not going to go through all of this right now. This is available online that you can take a closer look at, you can read. So hand hygiene, just a quick go through. This is not solely for acupuncture. This is a universal or standard precaution guidelines in general. After touching any sort of blood, body fluids, contaminated materials, after you take gloves off between patients, these are all times we wash our hands. We're using gloves or other types of protective equipment anytime we are anticipating that we'll handle blood or other, types of infectious material, or for touching mucous membranes. For example, there are some practitioners who do bloodletting on the inside of the cheek. If you're doing bloodletting on the inside of the cheek, you may not. So what you do is you hold the person's mouth open, you grab their cheek and pull it to the side. You cannot do that with your bare hands. You're touching mucous membrane. You must use a glove to hold the person's cheek, move to the side before you do bloodletting there. So anytime you're touching mucous membranes, we use personal protective equipment. Okay. Anytime we're doing a procedure where we're assuming that we're going to have a splash of bleeding, we do have to wear either face masks or other types of things like a lab coat. Right. If you do have blood that gets on gloves, which is very common, there's proper glove removal technique that we'll demonstrate during the practical demonstration. Some of these other things are some other basic guidelines. We'll go through some of these, and some of these we've talked about before. So this is just a standard precaution summary, and here on this slide you'll see the URL. So this you can go read a little bit more about yourself later on. Okay. Any questions about standard precautions that have come up? Okay. Well, why don't we we're going to take a short, how long do you want to take a little break for?
Like 10 minutes?
We'll take is 5 minutes enough? You want to take longer? We'll take a 5-minute breather here. We'll change tape, and then we'll be right back. Any questions that come up, feel free to type them in, and Donna will relay them, and we'll see what questions we have to answer. Okay.